We now move on to future notes. For this, I invite Mr. Rajiv Gupta, 1993 year IITBHU alumnus, current president of AIBA, to introduce Professor Rakesh Bhatnagar, Vice Chancellor, BHU. Over to you, sir.
Thank you, Kirti. I would like to invite Professor Rakesh Bhatnagar, who is an excellent academician, a brilliant vexillologist, a great researcher. His team, I was really, sort of surprised to know the amount of achievements that Professor Rakesh Bhatnagar has done. His team came up with a vaccine long back for rabies, and he's the president of India Visitors Award for Innovation. He got it in 2016. He's of course Vice Chancellor of B.H.U, and he has served as the Dean of the School of Biotechnology at Jawaharlal Nehru University. A very passionate academician who's trying to build institutions so that they can contribute to nation building. Dr. Professor Rakesh Bhatnagar.
Good afternoon. Myself, Rakesh Bhatnagar. I started out as a basic medical scientist and was involved in developing vaccines, developing diagnostics, and creating technologies which are used in healthcare industry. And when we talk about the future of healthcare in India, we have to look at the past, how we have done in the last 72 years in the healthcare of this nation. Let me be very frank that our population has been increasing, and in the last 72 years, the population has grown something like 4 times. But the healthcare industry has grown a lot, but still there are many people who are not able to take advantage of healthcare. And I can share with you that there are a lot of people who are not able to get the proper health care, and they die because they are not able to afford the surgery, or they die because they are not able to afford the cancer treatment. Therefore, we have to look afresh. How should we take care of the health of the nation as a whole? And in my opinion, everything starts from home. The first thing is that we should teach our children to understand the basic hygiene. Quite often we have seen in this country that many children, they suffer from diarrhea and they die. And it is easily avoidable disease by knowing the basics of minimum hygiene standards, which perhaps our fellow countrymen do not know. Therefore, in my opinion, the charity begins from home. From home itself, the children have to be taught proper hygiene, and the hygiene should be integral part of our primary education and secondary education, so that many avoidable diseases can be avoided. In our country, there are 80% of the diseases are communicable diseases, and 80% of them are avoidable. But because of lack of knowledge, because of lack of information, people are not able to avoid. I still remember I saw a movie of Satyajit Ray. Some of you would have seen Ashwini Shonket. In that movie, a doctor came to the village and a lot of people were dying of cholera. And people believed that if you if you drink some prasad from the temple, it is the gift from God, and it is always going to be good. But they did not know that that prasad was made with some contaminated water, which had infection of cholera, and people were dying, and the doctor had difficult time to explain people that they have to avoid consuming contaminated water. So this is the situation of our country, that particularly in villages people are not knowledgeable enough to avoid the infection. So my suggestion to the nation would be that we should have some kind of a small, just like in engineering, you have a engineering degree, but then you have engineering diploma also. And I think Bangladesh has practiced that. They have a small degree of medicine, which takes, I think, 2 or 3 years, and the person is trained to take care of the common ailments of the poor people. So if we have the good basic hygiene education at home, if we have basic hygiene education in the school, in the primary school, in the secondary school, and then we have some uh, well trained, let us say, diploma doctors, diploma holder doctors, just like diploma holder engineers, to take care of the small diseases, avoidable diseases, by knowing some common medicine and some common diseases to avoid, so that they can become something like a doctors in the village and the small cities. I think they can take care of the health care of the poor people. Now let us come to the next thing, that is taking care of the complicated diseases, the uh, lifestyle diseases. See, in the cities, we have seen that most of the people, they suffer with hypertension, diabetes, heart diseases, etc. But most of these diseases are avoidable by even modulating our diet. But we don't do that. India is a country where people give more emphasis on taste rather than nutrition. I have practiced myself in my whole life to eat healthy food. I am a 69-year-old man, going to be 70 maybe after 8 9 months. I suffer with no disease, no hypertension, no diabetes, no problem with the heart, kidney, liver, lung, anything. I am not on any medicine regularly, unless I have some, let us say, allergies. So sometimes I may take some anti-allergies, but I am not on any regular medicine. And I could only do by having a very simple lifestyle, having simple food, nutritious food. For example, I take a couple of fruits and yogurt in the morning as my breakfast. I take simply one or two chapatis and dal and some green vegetables along with some salad during the lunch. And in the evening also I take one chapati and green vegetables. And I do not eat much spicy food. I take twice a week fish, which is a very good source of plenty of nutrition, and I am able to live healthy life without seeing the doctors. So we have to change our lifestyle. These days, even younger children, teenagers, they are eating more junk food than we used to eat, let us say, 30 or 40 years back. So we have to modify how we live our life. I have seen the young people are obese. When I try to measure my BMI index, I am still in the middle of normal weight, normal BMI. But if you meet the younger people, maybe in their teenage or in their early 20s, they are obese. They are not only overweight, they are obese. So all these things result in all kinds of diseases. So, in my opinion, first of all, our citizens have to be taught how to avoid avoidable diseases. And I tell you, if we are able to do that, the burden on the healthcare industry will be minimal. Where you cannot avoid a disease, certainly you have to go and see a doctor and you get treated. And secondly, our healthcare industry has to come forward and join hands with IITs, with ISCs, with central universities and science departments, and have collaborative projects. I remember I have done such collaborative projects with the healthcare industry and transfer the technology to them easily. If we sit together, we understand their need and they understand what we can do. I think these bonds can help us to develop new products which can go to the healthcare industry, which has not happened in India quite often. In the university system, people work on, anything they would like to do. They give some research problem, student is able to do few experiments, he or she is able to publish few papers, and then you send the thesis to two of your friends, they say it's very good, and you give PhD, and all this is added to your biodata, and you become you get your promotion and you become a professor. This is not the way to do that. We have to understand the need of the nation, and the healthcare industry should come forward and interact with the academic institution and get their help, because we know that our academic institutions have very knowledgeable people who have been attracted from different parts of the world, highly trained people. They can understand their need and they can help them to develop new products which are needed for the industry. And instead of that, quite often I see that these industries, they look for the technology developed abroad, or they look for already developed products and they buy them and they sell them in Indian market. This is not going to help our country. We have to be self-sustainable and we should develop our own products so that we don't have to pay the high cost of the technology, or we don't have to import the already finished products. So therefore, my suggestion I mean, in short, if I conclude my 15-minute talk, that we should start with the very good hygiene education in the childhood. We should train our illiterate people by television media or any other media what is the hygiene, how infectious diseases can be avoided, how they should use the good nutrition to raise their children, they should eat good food, and how they can avoid the diseases. And eventually our industry and universities, industry and IITs, industries and medical institutions should join hands together to develop new products so that we can become leader in developing the products rather than depending all the time on imported products. And this huge country of 1.3 billion people cannot afford. We have to innovate ourselves. We have to understand our needs, and there is enough competent manpower available in our higher education system. They can come and help the industry to develop new products. The only thing is industry and university, industry and higher education institution should meet more often, sit together, understand each other's need and each other's competence to help the industry to develop new products. So, with these words, I thank you very much that you invited me to deliver this small talk, and I hope that we will all take this message and pass it on to the right people to have a good, healthy future of this great nation. Thank you.
Thank you so much, sir, for emphasizing on personal health care, hygiene, and nutrition, and enlightening us through your very own example. Thank you so much.
Thank you.